Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Then, what are the actions of insulin? Okay, insulin actually it inhibits the gluconeogenesis. Number one, by how does it inhibit gluconeogenesis? It inhibits the gluconeogenesis by inhibiting the phosphoenol pyruvate carboxykinase enzyme, which is involved in gluconeogenesis. It also inhibits genolysis. It inhibits glycogenolysis by inhibiting the enzyme. It inhibits the enzyme phosphorylase, and thus it causes uh, it inhibits glycogenolysis. Then it stimulates the glycolysis, that is nothing but utilization of glucose, and it also stimulates the lipogenesis also. Then glucose increases the triglyceride synthesis, and thus this glucose also results in increased fat absorption also. Glucose is involved in increased fat absorption also. Then what about the protein synthesis? Glucose increases protein synthesis also. Then pharmacokinetics of insulin, that is endogenous insulin. Pharmacokinetics of endogenous insulin. Insulin is actually a short acting molecule, and the half life of insulin is almost equal to 5 to 10 minutes. So in the endogenous insulin requires endogenous zinc, which is actually important for storage of insulin. And one more important thing is exogenous zinc is also used in insulin, and this exogenous zinc, which is used in synthetic insulin, it is increased. It is used. This exogenous zinc will increase the shelf life of insulin, and thus it is used in insulin which is produced from external source also. So this endogenous insulin, it's actually metabolized by an enzyme called as insulinase, which is present in the liver and the kidney.
thank you and thank you for watching.